And then after 5 years, I moved up the street to the provincial government. And again, I was lucky. So I came there, they already knew I was a person with mental health history, right? And they were already on that lookout for what I was going to be doing. Again, I got lucky because the Charter of Rights and Freedoms had just been passed in Ottawa, and the provincial governments had to bring their legislation into line. And there were all sorts of problems with our Mental Health Act. My God, there's my issue right there, right the first day. It's on the agenda. And it was extraordinary. And I got, I was a placement for the MSW program at U of T, and I got an MSW student right as I was working on changes to the Mental Health Act, and it was a young woman doing the MSW, and I got her working on that, and she actually got involved in changing the freaking law. I'm thinking, what about that for her career? Like, you imagine, it was, again, a total fluke, right, that it was on the agenda. We had a minority government. I had a very strong relationship with the leader of the Conservative Party, Larry Grossman, who we had worked on mental health issues earlier. He was the person that Pat Capone brought to see the rooming houses in Parkdale, and he was so shocked that he started supportive housing in Ontario. So you get this confluence of timing and agenda and profile and experience. Like now I'm a veteran Paul. I know how to make stuff go. I know where the levers are, right? And I knew all sorts of people in the bureaucracy in the mental health, in the Ministry of Health, because of my volunteering with the Canadian Mental Health Association at the national level. I already had international experience where I'd been to Holland and seen that they had a full-time patient advocate who was an ex-psychiatric patient, paid by the government of Holland to be on the lookout for psychiatric patients. Imagine that. That was in the mid-'80s. So, yeah, it was good for my agenda to be openly talking about my experience in the mental hospital and what that was like and what was wrong with that and what was wrong with our approach to vocational rehabilitation. And imagine sending me to work in the kitchen at Banbury Hall, for God's sake. You know, like, what were they thinking? One of the things that I discovered was the Neighborhood Legal Services was organizing in rooming houses. So we because our funding was for casework, didn't mean that we didn't do organizing and legal education and law reform. We did, but we had to do that with our discretionary time or with volunteer time. And one of the things that we were doing was we were trying to teach people about their rights. One of the things we discovered was that if you're a roomer and a boarder, you don't really have any rights because they were not protected by the Landlord-Tenant Act. So they weren't tenants. So they could be evicted without notice and without cause. And they were all the time. And we called those garbage bag evictions because the landlord would enter your premises, put all your stuff in a garbage bag, put it on the curb, and you'd come back and your key didn't work. So immediately we realized we've got to change the law. And there is a fabulous conclusion to this story, because so we started to do this in 1972. And in 1987, my law to change the Landlord-Tenant Act passed the legislature, and it was a private bill. And it was, timing again was, I was fortunate that the government supported my bill. And you think, wait a minute, 15 years, right, to get that change. And why did it happen? And it happens, A, because you create a platform to carry the issue because it's going to take a long time. And so our platform was neighborhood legal services. And by the time 1987 came along, all the community legal clinics were in favor of that change because they were all dealing with similar issues. And so Parkdale Community Legal Services here in this neighborhood, we're dealing with people who are garbage bag evicted all the time. So that was a good day.